The sale of fake COVID-19 vaccination certificates and cases involving unvaccinated Umrah pilgrims have exposed loopholes in the SOP monitoring and enforcement. Public health specialist Dr. Farhan Rusli shares his thoughts on the matter.
In effect, it actually boils down to a systematic, treason by the people, and then they are trying to lie their way into the system. So the doctor himself is involved, the public itself is involved. I'm not sure about the travel agents. I don't know whether they're involved or not. But you can only check so much, and you can only expect the immigration officers to check so much. Because how do you tell if I bring a vaccination card that's been stamped by a medical professional, whether it's real or not real? You obviously need to take that card into what it is. So in the end, definitely you cannot have 100% perfect system, but rather you can have a system that is actually well monitored. And this is exactly why you need to have proper audits in place. And I understand that this boils down also to the multiple stories where vaccines were being sold off and all that. If you remember when we were talking about it a couple of months ago. And this actually is one of the things that was actually done, where the doctors would actually sell off some of these vaccines, and perhaps to those people who did not want to get the vaccine but just wanted the vaccine certificates. So with all of this, right, you have to take all these external factors into account, and you have to plan your public health measures well, because you know that the Omicron variant is actually already in our community, even though we've tried to be gatekeepers and ensuring that only vaccinated people get access to, for example, like IKEA or big convenience stores. Yet, some of these people would have gotten through this loophole, and these people would actually be the ones carrying this virus without anyone knowing. So, in the end, Sarah, there is no definitive way of actually checking or actually making sure that everyone is really vaccinated or not. But rather, this is where you talk about public health empowerment, where people must know that it is their own personal responsibility to get themselves vaccinated.